in the pelvis we have the sacral plexus, plexus sacralis, yeah? It will form by the truncus lumbar sacralis, which will form which branches? Okay, 1, 2, 3, 4, yeah? This is the sacral spinal nerve, anterior branches of the sacral spinal nerve. And as you remember, only the anterior branches form the plexus. Then these fibers will fuse, form a plexus and divide into 5 terminal branches. So it will happen inside of the pelvic region, inside of the abdominal cavity. And it needs to go to the posterior. So if you say the lumbar, anterior lumbar plexus, sacral plexus, posterior side of the lower limb. So how it will go from the anterior, from the abdominal cavity to the posterior? It will go through the foramen ischiadicus major. Yeah, here we have the foramen ischiadicus major, great sciatic foramen. It's formed by the iliac bone, sacrum, and here we have the ligamentum sacrospinalis. This is the spine, and this is the great sciatic foramen. But the great sciatic foramen is divided by the musculus peroneus or piriformis, and we have 2 foramens here. Foramen supra piriformis and foramen infra below this muscle. Yeah? And the nerves will go through these 2 foramens to the posterior side of the leg. Where is it? So this is musculus piriformis. Do you see it?
Yes.
So now where is it? So it's inside of the abdominal cavity, and then we have it outside. This one again, the musculus piriformis. Yeah, this one. This gluteus maximus carting, and open, and you see it here. Yeah. And what do we have here? 5 nerves of the sacral plexus. The first one and the single one which come through the foramen supra piriformis. This is the nervus gluteus superior, superior gluteal nerve. This one. Do you see it?
Yes.
It goes laterally and up, and will innervate the upper part of the gluteal region. Then we go from the medial side to the lateral side, and most medially, which from the foramen supra infra piriformis, we have the nervus pudentus. Here it is, the pudental nerve. Come from this side, it will be better for you. Yeah, this is the ligamentum tuber sacralis, and this is the nervus pudendus, which will go to the perineum and will invade the diaphragma of the pelvis. Yeah, this one. I forgot the name of this ligament. Ligamentum. I forgot. So ligamentum sacrotuberale. Yeah, we have the sacrospinale here, sacrospinale, and we have the sacrotuberale. This nerve goes under it and will go to the perineum. There. Goes, and then it will invade the external genital organs. Then, second branch here, we have the nervus gluteus inferior. Yeah, superior, upper part of the gluteal region, and inferior, lower half of the gluteal region. There we have the, it's cutting here also, yeah, nervus cutaneus femoris posterior. It will innervate the posterior side of the thigh, the posterior cutaneous nerve, yeah. And this is 4, yeah, pudental 1. Gluteus inferior 2, gluteus superior 3, cutaneus posterior 4, and the biggest one, this one, nervus ischiadicus, which will go the most laterally. Yes, first it will go posteriorly of the musculus gluteus maximus, then it go back, and it will lay behind or deeper. Then the musculus biceps femoris, it will lay between the musculus adductor magnus and musculus biceps femoris. Then it's go down, and it will divide it into two terminal branches. Yep. Nervus tibialis, which will go to the posterior part of the leg, and it will go deep in the leg, and then it will go to the medial malleolus canal, and then it will go to the foot, yes, to the planta pedis, where it will divide it into two branches. Nervus plantaris medialis and nervus plantaris lateralis. So once again, yeah, nervus ischiaticus, nervus ischiaticus, nervus tibialis, medially, tibial nerve, here, tibial, and then nervus plantaris medialis, nervus plantaris lateralis. Clear? Second branch of the sciatic nerve is nervus pyraneus communis or nervus fibularis. This one, yeah. It goes laterally, communis, and then it divided into two terminal branches. First one is the nervus pyraneus superficialis, the superficial fibular nerve, which will innervate two muscles, musculus pyraneus longus and brevis. It will go on the lateral side of the leg, then it will go to the dorsum pedis on the foot, and will innervate the skin of the lateral side of the lateral malleolus and lateral side of the dorsum pedis. And I can't find it here, I think. The second branch of it is a nervus pyraneus profundus. We can't see it here, because it will lay deeper behind of these muscles. Yeah, it will lay in the membrana interossea. Do you remember it? We have the tibia, fibula in between there. Here.
Yes.
We have the membrane. And this nerve will go to the lateral side, and then it will go here. Interosseous membrane to the foot. Imagine, this is the nervus ischiaticus, sciatic. Then the common pyraneus. Then we have the superficial, which will go to the lateral side, yeah, and we have the deep branch, which will go to the back. This is the nervus pyraneus profundus, nervus pyraneus superficialis, yeah. And here we will name it. It will go between the two fibers, or how can you find it? You may find it between two bones on the foot. And it will name the nervus dorsalis pedis, the terminal branch of the nervus pyraneus profundus, and it will innervate the tissues of the medial side of the dorsum of the pedis. That's all.